I think we're collecting people as we go. Have we got everybody back, Ewan, or are we still in the process?
Yeah, everyone should be back at the same time, but I'm noticing people are coming back in dribs and drabs, so maybe give it 30 seconds or so.
Okay, that's absolutely fine. So what I'll maybe do is give the heads up to the facilitators in the meantime. I'm going to keep you to task here. I'm going to ask each of the facilitators to share with us 2 key points from each workshop. Okay, and you're not allowed 3, you're not allowed 4, you're only allowed 2. If we can start to think about those 2 key points and start to think who would like to go first. In terms of facilitators, we didn't number the groups or call them anything, Ewan, did we? So
yeah, well, Will's group 1.
Okay, right.
And Karen's group 2, so I'll keep you right.
Okay.
If you want to
Will's head. Will, are you ready to offer us 2 key points from your workshop?
You've absolutely thrown me under the bus there, Ewan. Yeah, that's fine.
Sorry.
Happy to do that. Yeah, it was a really, really good discussion. I'm a bit gutted that I've only got 2 key points because there were loads of good points made, but we have captured everything. I think the 2 things that really struck me was there was a real sense about the fact that we need to recognise with this that one of the challenges is lots of the issues we're talking about while we're calling these neurology networks, a lot of the services involved that people experience aren't necessarily neurology services, and just recognising that and the general kind of complexity of the landscape we're looking at. But clearly people felt there was real value in using the networks to bring people together and break down silos, as long as there is a clearly defined purpose for the network and it's not crossing over and sort of impinging on things that already exist. I think I possibly sneaked a 3rd point in there, but that would be my summary. Thanks.
Thank you. Well, I was giving you the benefit. I was thinking that was one, so well done. Thank you very much. Karen.
Thank you. Yes, like Will, we had a really good discussion as well. Yeah, it's hard to choose just 2 points. So I think one point that was pretty unanimous in terms of the kind of how improvement networks can help us to overcome challenges. Resource sharing was something that was sort of shared fairly unanimously. And I guess my second point, I have to choose one, is that we kind of need a really well-defined purpose for the networks. And, I think that has to be sort of considered quite carefully, and particularly around the wording of what that's going to be.
Thank you, Karen. Did your group come up with any offers for what that wording could look like?
Nothing specific, but yeah, there's some words maybe that would be best avoided, I think, or yeah, just reworked, really.
Yeah, that makes perfect sense. Ewan, who's number 3? I feel like a bingo caller. Number 3.
Richard's number 3.
Richard, thank you.
Yeah, like Karen and Will, it's very difficult to keep it to 2 points. So coordination of resources was flagged up really highly. Better strategic engagement to make sure that resources are being used better, and self-management was a really strong element in terms of keeping people well and not having to sort of come back in and revisit services continuously.
Thank you, Richard. Come in, number 4.
Tanisha, number 4.
No, it's not Eurovision Song Contest, love it. So we talked a bit about resources. Clearly resources, one of the biggest challenges the network would be supporting people to overcome, but not just money resource, but actually staff time is a really difficult resource. So we had a bit of a chat about the importance of having kind of like non-clinical support in terms of helping to drive improvement. So having support, the appropriate kind of skills to support data collection. So data collection is going to drive the improvement. And it's what support could be to given towards the data collection, because it's not necessarily, you know, clinicians are not necessarily the best placed individuals to pick up around that. Also, we had a helpful discussion about how we sort of include or meaningfully involve people with lived experience into the networks. And so there obviously there are various condition-specific forums that exist through different organisations, but we also talked a bit about the things like the Neuro Voices programme, which in the past has helped to sort of train, if you like, more generic representatives to be able to grasp the kind of NHS and social care infrastructure, and then able to kind of input around that on a slightly more sort of level playing field alongside other network members.
Excellent. Thank you very much. Number 5, please.
Susan.
Susan.
Thank you. Again, we had a fantastic group and fantastic conversations. Not to use the dirty word of funding and resources, but that was obviously discussed quite extensively. And the increase that resources or the increase that services are experiencing with no increase to funding and no increase to resources, and how that can then be sustainable. We did have one fantastic practice sharing information about a journal group, where they would have an extended lunch break, where they would have some information where they could share some case studies, and it was really interesting to see how that could maybe be implemented in other services and sharing practice. But again, it's about the resources to support that, to make sure that the services are able to support people having an extended break, and making sure that actually people can take that time out of their day when it's difficult to schedule meetings for basic things, never mind best practice sharing. But the conversation was fantastic. So thank you to everybody in my breakout room.
Thank you, Susan. And last but by no means least, Alice, please.
Thank you, Jenny. Yes, again, a wonderful conversation had. I'm just keeping my video off because of tech issues here. But the reflecting everyone else's comments as well, some of the two things I'd like to pull out are the challenges at the moment that people are facing, both with workforce and capacity to be involved. There's also reflection on looking at existing pathways and just checking they, you know, ones that might not have been reviewed or renewed for quite a long time is a big issue. And you know, these pathways already exist but just need to be updated, and there's a general lack of capacity to do that at the moment. So I think the manpower issue was definitely something that came out strongly. The value of the network would be the second point I'd like to make. It's definitely seen as something that would be very useful. Sharing of resources, as other people have mentioned, sharing of best practice. We talked a little bit on how to involve people with lived experience. Also useful for moral support, so people know they're all in the same boat together and can learn from each other from a networking point of view. And finally, that the networks, the value would be in supporting the delivery of any pathways and ensuring they can be entrenched locally. Thanks, Jenny.
Excellent. Thank you. Thank you very much. Thank you, everybody. I am going to just open up to some general questions just for the last few minutes. But while we're doing that, Susan, we have another poll, haven't we? So are you able to organise the poll so that people can complete that in time? But is there other points that people would like to, or other questions that people would like to ask just while we have 6 minutes left? 5 minutes, I've just been told, according to my team's instruction. Any questions or comments or observations that anybody would like to make from the session today? No? Oh, yeah, John Reid, do come in.
Sorry, thank you. Just one of the things that came up in ours was that it would be nice if we had sort of measurements of services on an annual basis. You know, what are the staffing levels? Seems there are some areas where there are published annual standards like UK Parkinson's and the MS standards, but it'd be nice if that was there was an annual document that compared all the regions, just to give us a measure of some quality, because that seems to be lacking.
Okay, that's an interesting thought, isn't it? Yeah, that's a really interesting thought. Yeah. Okay. Any other observations, comments, questions? Oh, you've all gone quiet on me. Yeah. Yeah. Oh, the links are not working again. Mary, do come in.
Yeah, thanks, Jenny. I just wondered, what was the plan after today? I mean, are you going to share the slides? That would be great. And is there another, what is the plan for the network? Is there more meetings planned? You know, does it depend on what happened today? I don't know, just some sort of outline would be great. Thank you.
Okay, well, I'm coming to that. Yep, I will come to that just in a few minutes, just once we give people the chance to complete the poll, and just to make sure that we've picked up any questions. So in terms of moving forward, we will compile notes from the breakout rooms from today, and also the evaluation polls, and these will be sent round to delegates together with a copy of the slides, and also you will be given access to the recording of the session online. We were actually oversubscribed for this event today, so there's lots of people out there who do want to be part of the network who haven't been able to join us. Based on the information that we've collected today, we will develop a networked charter, which will be developed as a result of the discussions, and delegates will be asked to input into this as we move forward. The intention is to, Richard, keep me right here, but the intention is to continue with further sessions, and some of the outputs from today will help to inform the programme for subsequent sessions. But I'm just going to use a little bit of chair's license here. If people do have ideas or thoughts or suggestions for topics or resources or aspects of examples of good practice that you would like to share wider, then we would be really keen to hear from you. That would be directed to Richard, is that right?
Yep.
So it would be really good to hear from you as a network. I think a lot of the discussions we've had internally around this are around who owns the network, and you know, the evidence would suggest that networks are most effective when it is owned by the members. So it's about how we find that balance between offering the structure and the support and the opportunity to engage, but also not being hierarchical in terms of this is what we think the network members want to hear. So we genuinely are committed to this becoming, you know, owned by the network, and we need you to help us with that in terms of moving forward. Richard, just quickly on that point, do you want to add anything at this stage?
I think we need to engage with everybody. So we've got, you know, everybody that's at this session today, and as well as people that were involved in the completion of the self-evaluation. We will send out a consultation document. Well, I hesitate to say consultation document. We're going to shape what we've heard today into a framework for moving forward. That will be sent out to everybody for comment, and we will organise sessions similar to this, based around the themes that have come up as priorities today.
Excellent. Thank you very much. Okay. So one last chance. Any comments, questions, anything that somebody's left with burning desire to say that you haven't had the chance today? No? Okay. On that basis, then, I would like to draw this session to a close. Thank you, everyone, for attending and participating in the session. There's been some really good information that's been shared, and it's great to hear the different work that's going on across Scotland, and how people are achieving that within these very challenging times. So on behalf of the Neurological Advisory Committee, I would like to thank everyone and look forward to our next session. Do take care and have a good day. Thank you, everybody.
Thank you.